Hello and welcome to our Going Virtual Webcast. My name is Nick Severino, and I'm the Vice President of Marketing at First Stop Health. The Going Virtual Webcast is here to dive into the topic of virtual care with various guests each month. In this month's edition, I'm pleased to bring on Ken Lankin, Enterprise Medical Director with Jefferson Occupational Health Network. Welcome, Ken.
Hi, Nick. Thank you. Great to be on the program.
Glad to have you here. Before we really dig into the podcast today and dig into virtual care, I'd love for the audience to get to know you a little more. So can you just share a little bit about yourself?
Sure. Well, I'm the Enterprise Medical Director for Thomas Jefferson University and Jefferson Health, which is the result of a growth of a number of health hospitals and systems in the Philadelphia area and southern New Jersey. Jefferson Occupational Health serves approximately 43,000 employees in the area. I am a physician by trade, but I got started in healthcare years before medical school as a medical records technician and as a lab technician. I served in the Navy for 28 years. Where I had the privilege of receiving my medical training to include a residency in family medicine and a second residency in occupational and environmental medicine, which is what brought me to the employee health arena. I had the chance to work and travel to every continent except Australia. And I did have assignments in Antarctica, Peru, Afghanistan, Japan, and for 2 years I served as a ship's medical officer. As computerization, which is your area, developed, I was involved as a super user and a representative for the ambulatory care space. Prior to arriving at Jefferson, I served as the associate corporate medical director for JP Morgan Chase, another large global company, to lead the clinical excellence for their on-site health and wellness centers and to act as a internal consultant for issues of public health, wellness, and disaster preparedness. Personally, I have a cat, 2 hermit crabs, and I sing as a baritone with the Philadelphia Boys Choir and Chorale, along with my son Edward, who is an alto 1.
Wow, quite the diverse background and even where you are today. So, well, first, I want to start with, obviously thanking you for your service. I really appreciate that, obviously, as a veteran here in the U.S. But I want to talk about your experiences and better understand what experiences you actually have, maybe in the military or in your career with virtual care.
Right, absolutely. Thanks, Nick. The first thing I wanted to say is I think a lot of people think virtual care is something really new and maybe even something associated with the pandemic, and it's not really the case. Telemedicine has been around a long time, at least since the Civil War, when battlefield medical needs were communicated by telegraph. I'm not that old, but I can think of a few times in the military when we used virtual care, 3 decades ago. In one example, when I was a ship's medical officer, we were on a diplomatic deployment around South America, but we did have a SEAL team with us, and they were sent inland on the Amazon. And one of the SEALs became very ill, very high fever, and the only medical person on site was a young hospital corpsman, a guy who might have been 22, 23 years old with just some very basic medical skills and training. And he had radioed us. You have to remember there were no cell phones at the time, no email. He radioed me back on the ship. And from there, he was able to explain what was going on. And I was able to, he had medicine on site, but, he's not a healthcare provider, but I was able to guide him and give him the permission in that military moment to administer a medication, which would normally be the purview, of a licensed medical provider.
Yeah,
So
amazing. Yeah, amazing story there. I mean, that's people don't realize that context that virtual care in that modality really, served an incredible purpose, has really been around as long as it has, and continues to help people. So with that, so over your years of experience and that diverse background that you told everybody about in your introduction, what lessons have you really learned from your healthcare experiences related to virtual care?
well, I think the biggest lesson, and that you know, being in the Amazon and getting sick is just a great example of how versatile virtual healthcare is, um, and that there's so many areas for creativity, and um, we use this expression in the military a lot, being a force multiplier, but it's really true, and it's true for healthcare organizations as well. Um, the idea is that you could treat a variety of um, illnesses, and the efficiency and the convenience is amazing.
Right. So I mean, you hit on an incredible topic that a lot of people are starting to or planning to use virtual care for, which is just not just urgent care, but full well-being, not just physical, but mental. Can you elaborate further on how you see or where you think virtual care is going to help people manage that physical and mental health side of their total body?
Yeah, absolutely. So we have to, in utilizing this technology, and we're constantly looking for efficiencies in healthcare. It's not necessarily the best things. There's certain things we just simply can't do. I don't think it might be a while till we could do virtual dentistry, for example, but it's so applicable for many of the conditions that we already have, such as digestive orders, urinary tract infections, minor cuts, sprains. And why do we have to drag people, into locations that may not be convenient for them, having all the in the time that it takes to make the appointment, they could have had the appointment doing it virtually. So it just creates tremendous opportunities for access, convenience for patients, and for providers alike. I was actually very envious of some of my colleagues during the lockdown who were doing telemedicine from uh, a log cabin in Vermont.
Yeah, I hear that often from our own doctors and clinicians that help the nearly million members that we have, is that they don't have to go to the office any longer. It's readily available, the modality to be able to help and treat people. And that's an area I think that I'd like to dig into even further. Like, let's talk about that. So, we talk about, yes, it's available to treat urgent care, it's available to help people with counseling, it's available to help treat with other illnesses and things. But what about ongoing care management? Chronic conditions, whether it be diabetes or other chronic conditions that people battle, and it helps not just the person, but the clinician help provide maybe a better, more efficient and effective care program for the duration of that condition.
Right. So the things that you just described, and these are the major drivers in healthcare, the big issues, the prevention that we can and should be doing, whether it's diabetes, hypertension, management of asthma. All of these things are fundamentally knowledge-based initiatives to take care of patients, as opposed to physical things like surgery. There's tremendous opportunities to go over these things virtually with patients. You can share data. One of the exciting things that I wanted to share also is just in the field of sleep medicine. Um, in prior years, people who had sleep apnea had to take their machines, had to make an appointment, had to go take their machines to their appointment to get evaluated. Totally unnecessary with virtual medicine, virtual care. The machines can send the data via Wi-Fi, so therefore the healthcare providers can get that information and just have a phone call with the patient. How you doing? How you sleeping? I can see how you're sleeping because I already have the data here. Um, So there's no need to drag machines around. There's no need to upload. There's no need to even bring a chip in. It can all be done electronically.
Yeah, those innovations are definitely incredible. And everyone speaks to the virtual care modality in general as an incredible innovation. But in your career and your experiences, what do you think the greatest innovations in healthcare have really been, during your career?
Well, I might not give a typical answer to that compared to my colleagues, but I would say there were two things that really revolutionized healthcare during my career. The first thing I would say is flexible fiber optics, and that's because that's what allowed endoscopy, colonoscopy, laparoscopic surgery. These are all things that had to be done open. Early, when I was a medical student, there was no such thing as laparoscopic cholecystectomy. You had to open somebody up. You had longer. So all these things helped reduce time, hospital stays, pain, but we wouldn't be able to do it without the underlying technology of having the flexible fiber optics. That's what allows a surgeon to do an arthroscopic surgery, for example. Without that underlying technology, it would not be possible. The second thing really is, I would say, is computerization in general. Not just electronic health records, but the computerization of data, of records, of lab data, or radiology data. I had mentioned that I started in healthcare as a medical records technician, and I just remember the laborious efforts to just find records that were all on paper, and things would fall out, and they were stapled, and they would rip, and they'd be illegible. And even as an intern or a medical student, in order to get results, you had to go to the lab, because there was no computer. And where are the lab results? They're on like little pieces of tissue paper in a shoebox. And theoretically, they're in alphabetical order, but what happens if, your name's John Smith or Susan Brown? It's really hard to follow. The reason so what computerization does is, A, it makes the access to data to take care of that individual patient. Number two, it allows the provider, I believe, to give even better care. I remember the first time I was able to use our electronic health record system. It was so simple, Nick. This thing was like DOS, like 0.005. Okay, it was just two colors, but it did have the ability for the first time that you could graph somebody's results over time. And we had a patient that was anemic, right? You say, oh, this is terrible. But you could see over time, were they always that way? Or is that something sudden? You would not, it just wouldn't be feasible without the computerization to do that. The third thing is population health, which is really near and dear to my heart and to us in occupational health at Jefferson, because our patient really is a whole population of people. And how do we understand what that data means, and how do we interpret it without the use of a computer? It'd be next to impossible. It's really helped us to accelerate the kind of advances and to do things that are meaningful and impactful in health. And at the same time, we can also sunset things that don't matter as much as we once thought they did. And that's what's also important in healthcare as well, is that we reserve our fighting strength to the things that matter the most.
Well, Ken, an incredible perspective that you provide on healthcare and the virtual care agenda overall. Unfortunately, we're out of time. I want to thank you so much for joining the Going Virtual Webcast. That will actually wrap this month's webcast. We hope you watch our next webcast. Again, I want to thank everyone for joining, and have a great day.